But who I've brought today is one of the very good customers and appreciated customers of Heimdal, NHS Northumbria, who have accepted to come by and tell a bit more about how they utilize Heimdal and what sort of value that they're getting from the DNS security tool with us. So thank you very much, first of all, Simon.
Thank you.
And I think we will just hit it off because I appreciate time is running. So Simon, first of all, what we'll be asking you about is obviously the DNS security product that you've chosen from Heimdal. And I think one of the first questions that I would like for you to tell a bit more about is why DNS security was an important tool for you to add to the tech stack.
I'm very fortunate that I've had an annual cyber budget for the last 3 years, and when that was put in place, that provided a spending plan indicating what we do with the money, the usual things, SIM, mail hygiene, reactions to the compliance changes and stuff, medical device analysis, so multi-factor, privileged access management, etc. And we had MDE and next-gen firewalls as part of another project. So I was always looking for tools that we could deploy and manage as a security team that didn't involve a lot of resource and many teams working together. What could we do and what could we manage and deploy quickly? We're doing network access control and we're doing some network segmentation, but that's not a quick process. That'll deliver a great result when it's in, but we've got a legacy network that grew in the past through accretion, not necessarily in a managed way. So we've got a big network we're trying to understand fully. So I was looking for things that we could do in security on our own, get something in that would improve our assurance. And I really just wanted to add it as another backline of defense. And we've got firewalls and doing all sorts of filtering detections. We've got web filtering, mail hygiene, URL hygiene and checking. But if things that do get through, we need as much assistance on that goal line as we can get, not only to block and stop stuff, to provide actionable intelligence about what happened. And Heimdal DNS gave us something we weren't getting from any other tool.
Brilliant. Thank you very much, Simon, and definitely some interesting perspectives there. So the actionable data was obviously a part that was really, really important for you, and I appreciate that was part of the discussions when we initiated the chat with us as well. But another part is obviously when you are to start up with a new tool, new technology that you need to understand how to work with and so on. Parts of it obviously comes around the implementation and how you actually work with it. So could you explain a bit more about what your experience was when it came to the actual implementation of Heimdal?
Yeah, well, sure. As I mentioned just earlier before, this was something we could do as a security team. There was obviously an element of rolling it out, but it wasn't something that took a massive plan. As anyone who knows has been through the NHS bidding process, because I got this funded centrally, the timeline between central approval and the day you actually have the thing to be operational can be quite tight. And we'd understood from discussions with yourselves that you could spin it up in the cloud for us really quickly, and it would be up to us to manage the clients and policies. So any delays such as there were due to that. Our change control process, which is we've got to push the agent out gradually in steps, make sure there's no impact, and then when it comes to actually deploying the policies, that needed to go out in stages as well. But actually we ended up cutting that process quite short because there was a big NHS security breach last summer while we were deploying Heimdal. So it was just agreed we'd flick the switch and just turn the policies on across the board to get that extra assurance rather than finishing the next couple of weeks in the change process. So really we got it stood up very quickly. The impact was just change control and making sure that when it went out, it didn't affect anything. And it didn't really. We'd start getting benefits straight away. It didn't take a lot of management, a lot of involvement from other teams. It was specifically something I had on the list that I could do with my team and not be waiting on servers to be built, networks to be reconfigured, etc. It was just something we could do.
Yeah. Exactly. And I think that part around something that you can do as an organization in the security team it's an interesting topic to cover. So now that we're in that remit, could you perhaps describe a specific instance where our product actually prevented a potential security threat in your estate?
Yeah, we've had a couple recently. We've had, throughout the lifetime of the project, we've seen quite a few, but we've had a couple recently where it really helped in spotting and highlighting issues. In the first, the user had managed to install Wave browser, and when using it, had triggered all kinds of malicious links and web code. In the way Andrew was mentioning earlier, they went to what appeared to them to be one website, but in the background, all kinds of things were firing off, and Heimdal just spotted them and blocked them straight away. And it was the first of our tools to notice this activity, blocked it, and told us about it. And the second more recent incident was Heimdal blocking access to a malicious domain, which was driven by a malicious Chrome extension. And in both cases, Heimdal was the first to alert us to the activities and do something about it and give us a bit of a head start on investigating what was going on. In the second incident, it was a failure of a policy on a particular user's device that meant their home Chrome shortcuts, histories and everything synced to their work device and started doing things that we would never have allowed on a trust device. So there was a policy failure somewhere in our infrastructure that allowed that device to do that. And Heimdal gave us the information that was happening and allowed us to do something with it.
Cool. Sounds good, Simon. Sounds good. And an interesting area as well to actually understand how your team utilizes this data. So could you explain a bit more around the implementation of Heimdal and how that has actually impacted the team's productivity and efficiency around finding these attacks and mitigating the threats? Yeah,
certainly. It's still a balance on resources, because Heimdal does stop things autonomously, which is very helpful. But I've chosen not to just let it lie there. Heimdal stopped it. Let's walk away. Let's do something else. I've chosen to have a review process to dig into what happened, to see what it stopped, and to see if there's any further tuning to be done elsewhere in the security stack. So for the two incidents I mentioned, we could have just said Heimdal blocked it, let it be, but I wanted the team to investigate the circumstances which led to the high severity Heimdal alert, uncover the root cause. And in both cases that I mentioned there were some things that could be tightened up elsewhere. It spotted gaps elsewhere, and they both led us to change some configuration options and deployment policies as a result of what we found. So what we're finding really is that it's helping us spot where we might not have things as settled as we thought they were, or as controlled as we thought they were. I think that's really it. Really, it's given us that information to say, well, really, if everything else was working as advertised, as promised, Heimdal would possibly just sit there and not do anything, because nothing should be getting through.
Yeah.
But things get through, and it's an extra pair of hands just to go, this got through. Here's how it got through. This is the activity that caused this. So it's really helpful in that respect.
Happy to hear that, Simon, and thank you very much for shedding some light on it. And in the respective time and the fact that we've gone a bit over, I think my last question to you, Simon, would be, would you recommend Heimdal to other trusts? And if so, why would you do that?
Absolutely. I'd recommend everyone try the proof of concept and see their own individual risk profile in relation to this particular threat vector. We're a long-lived, very dispersed trust. We have hybrid working in many services. We've just completed our move into M365. We're moving more into Azure. As an NHS organization, we've got third-party connections and arrangements with councils and other trusts, and they're being reshaped all the time. And if we think about the new hospital initiatives that Paul mentioned, we can see the NHS is made entirely of moving pieces. And you can't ever feel like that's it, we're settled, we've got everything protected. Because from the minute you write that down, put a full stop and put your pen down. Things have changed. Things are moving. If you haven't moved for 2 weeks, one of the partners you're working with has. It's all changing all the time. So I would absolutely recommend that a trust try it to see what they see.
Wonderful. Thank you very much, Simon, and thank you for taking part of this. I really appreciate it. And I know from early on that in the event that someone wants to learn a bit more around it, you've been open to talk to them a bit about Heimdal and so on. So I just want to say to the audience that might be a possibility here as well if you ask Simon nicely. But thank you very much, Simon. Highly appreciate your attendance here.